Accounts and Investment Committee the truth and nothing but the truth, and that every statement and declaration that I shall make shall be made conscientiously, believing the same to be true and according to the Oaths and Statutory Declaration Act. So help me God.
Thank you. May I confirm whether the committee clerk of the County Assembly received the management responses in time?
Chair, we did receive the responses from Jaramogi Ngodinga Teaching and Referral Hospital on time. Thank you.
Thank you. May I again confirm from the Office of the Auditor General whether they received management responses in time?
Chair, we received the responses in time. We interrogated them, but the absent accountant went with our copy, back with our copy. So we are requesting the Chief Executive, if they have an extra copy, what party?
Chief Executive?
Oh, yeah. Thank you much, Honorable Chair. Yes, I have an extra copy, though my chief accountant was actually bringing the other majority of copies. But I can provide this. Thank you, Chair.
Thank you. Where is that? Okay, this is confirmed with the copy. Will you please hand it over? Bwana CEO, in the absence of any copy with you, how are you going to proceed then?
Chair, we have a soft copy. Okay.
Bwana CEO, I consider her as a stranger until introducing herself. I don't know the person we have with us here.
Good morning to you all. I'm Tipe Peresio Mino, the accountant at the Jaramogi Hospital.
Yeah.
CEO, now.
Yeah. Okay, thank you, Chair. And I want to thank you for your indulgence and accepting to give us those few minutes to have our CFO joining us. So I don't know the procedures of going ahead with it. Maybe you can give me some guidance on this. Okay, thank you, Chair.
Back to the Office of the Auditor General. What is the auditor's opinion and what informed that? You are invited to take the floor. Thank you.
Thank you, Chair. The audit opinion for Jaramogi Oginga Odinga Teaching and Referral Hospital for the year 2022-2023 was a qualified opinion. The qualified opinion means that although the financial statement presented fairly in all material respects the financial position of Jaramogi Oginga Odinga Teaching and Referral Hospital, there were some account balances or components which were not fully supported or which we flagged, and we have about 11 or 12 issues that informed the qualified opinion. Thank you, Chair.
Okay, thank you so much. Could you please go to question 1? Issue number 1.
Issue number 1 is on unsupported cash and cash equivalents. The statement of financial position, and as disclosed in Note 19A to the financial statements, reflect cash and cash equivalent balance of Kenya shillings 62,838,358. Included in this is a bank balance of Kenya shillings 193,393, which was not supported with bank reconciliation statement and a certificate of bank balance. In the circumstances, the accuracy and completeness of cash and cash equivalent balance of Kenya shillings 62,838,358 will not be confirmed.
Thank you very much. Bwana CEO, it is your time, but you are worried about the procedure. It is very clear when you take an oath, you are taking an oath on behalf of everybody. So if you have any issues, anybody can answer on your behalf, so long as it is there. Thank you.
Okay, thank you very much, Chair. Management response to this question or to this issue. It is true that the financial statements reflect cash and cash equivalent balance of Kenya shillings 62,838,358. Included in this is a bank balance of Kenya shillings 193,393. The management has currently done the reconciliation and availed the bank certificate. You can actually find these attached copies in Annex 1.
Back to the auditors.
Indeed, there was a certificate of bank balance, but the response provided did not include bank reconciliation statement.
Back to, before I give the members.
Yeah, thank you, Chair. As you are asking me to do, I have got my experts here. I have Director of Finance and also the Chief Officer or the CFO. They'll probably give those other details. But the fact is that we have done the reconciliation and also provided the bank certificate. Probably is the reconciliation that probably is an issue. But we have attempted as management to see to it that we cure this position. Thank you, Chair. Maybe I can ask Joshua.
Yeah, it is alleged from the Auditor General that you did not provide a reconciliation statement on the issue asked.
Thank you, Chair. So, as raised by the OAG team, I think that this is an education account that we are yet to close it off and swipe the money to the new retention account. That's why I gave the bank certificate, meaning that we're going to swipe the balances in the new account that we have in the Equity Bank, which is a new retention account.
What was the concern of the auditor?
It is true. We only attached the bank certificate.
So why did you fail to do that? Because that was a requirement.
We are sorry, I think it was an oversight. because we thought when we wanted to close it off, we could only just attach the bank certificate to prove to them that these are the balances in the account as at per that date that was requested. So on that note, I think we can avail the bank reconciliations.
Back to the members. Yeah. Why, from the explanation of the accounting officers, what can you say? The office of the auditor?
Yeah, the cash and the cash equivalent figure that we are supposed to take to the financial statement is the one that is gotten from the cash book. That is, the cash book is what tells the truth about Jaramogi Oginga Odinga. The bank's statement is an external entity. It's generated by an external entity. So the accounts that we were auditing were those of Jaramogi Oginga Odinga and not of the bank. So we cannot say that they have disclosed the correct figure for cash and cash equivalent in their financial statement. That's why we have queried the all 62,838,358,000, because we expect the hospital to maintain correct books of accounts. Thank you, Chair.
Chief Accountant, you said it was an oversight? If it was an oversight, now it is an issue. Because actually what informs what is in the bank, we can only see it in the cash book. That is what is the exact presentation of what Jaramogi is. James? No. James?
No, I was just waiting for her to really clarify on that, because as to what the auditor is saying, whatever is in the bank is reflected in the cash books as at then in the hospital. So I just wanted her to go ahead.
Something to say?
Thank you, Chair. I agree, Chair, that we are expected to provide 2 items here, to support the 193,393. That was a bank statement, and that we have provided. I think what we have not provided is the reconciliation of the same. And therefore, I want to commit that we are going to provide the same. We are going to provide it to this House and even to the auditors. And since my team indicated that it was an assumption, and I think it's a wrong assumption, that since we provided the bank statement, that that was going to suffice. So I think this is something that we are going to commit to provide. Thank you.
And you must take into note that you are a big brother to the smaller hospitals. You have to set the pace. So if you are coming to the assembly with oversight, it is on oversight. That's an issue on. It's now at least not required. So the matter is not resolved. Question 2.
Unsupported depreciation and amortization expenses. The statement of financial performance and as disclosed in Note 15 to the financial statements reflects an amount of Kenya shillings 1,412,854 in respect of depreciation and amortization expenses. The amount was not supported with depreciation and amortization schedules. In the circumstances, the accuracy and completeness of the depreciation and amortization amount of Kenya shillings 1,412,854 will not be confirmed.
Back to the accounting officers.
It is true, Mr. Chairman, that the financial statements reflect an amount of Kenya shillings 1,412,854 in respect of depreciation and amortization expenses. The management noted the concern and has now provided the depreciation schedule showing individual assets depreciation figures for confirmation. Find attached copies annex 2. Thank you, Chair.
Back to the auditors.
It is true, the table is provided now, but the challenge we had in our when we reviewed this, it was not possible for us to conclude because the Nini is indicated furniture and fittings. The depreciation is indicated at 288, and plant and machinery at 1.124420. However, there was no way we could determine the authenticity of these figures because we didn't have a full breakdown of the furniture. Because what we are trying to say, for you to see that furniture maybe at a certain percentage, the depreciation was done at a certain percentage, but we have to see the full list of all the furniture, the ones which had been depreciated to nil, and the ones which were supposed to be, so that we can make a fair determination of whether the 288 of the depreciation charge on furniture and fittings and the 1.1 million on the plant and machinery were fairly stated. So although it is provided, but there was no way we could determine the authenticity of these figures. Thank you.
It is confirmed from the auditor that the figures were not explained as required so that they could get the true picture of what you are presenting.
Thank you, Chair. Based on the auditor's observation, after the review of the document with them yesterday, they told me to give a self-explanatory on this. I should come with a detailed document really explaining how we depreciated the assets, which with me have additional documents to explain the area of concern that they raised.
You just have to present just present it here. I acknowledge receiving more. Okay, I acknowledge receiving additional evidence as pertaining to question 1.2. We give it to the auditor for verifications. Thank you. As they do that, we continue. Question 1.3.
Unsupported property, plant, and equipment. The statement of financial position, and as disclosed in note 22A of the financial statements, reflects a balance of Kenya shillings 2,855,201,687 in respect of property, plant, and equipment. Review of documents and physical inspection revealed that the hospital was in possession of several vehicles and ICT equipment, including computers, printers, and networking infrastructure, which were not included in the property, plant, and equipment. Further, the fixed asset register provided for audit did not reflect the book values of the assets. In addition, the title deed for the parcel of land occupied by the hospital was not provided for audit. Management indicated that the title deed had been missing since October 2020, and effort to trace it had been unsuccessful. In the circumstances, the accuracy, ownership, and valuation of property, plant, and equipment balance of Kenya shillings 2,855,201,687 could not be confirmed.
Back to the accounting officers.
Yeah, thank you, Chair. Management has noted. However, the facility is in the process of valuing all the assets to ascertain the value of all hospital assets. Started with the valuation of land and building, which has since been achieved. Find title deed copy attached, Annex 3.1. Evaluation of other assets has also been initiated by a memo reference indicated there dated 18 July 2024, done to the county secretary by Chief Officer of Health. Find copy of the memo attached. That's on Annex 3.3. The management has also appointed the Asset and Liability Management Committee that has begun the process of identifying all the facilities assets for coding awaiting valuation. Find copy of the committee appointment letter for confirmation in Annex 3.3. Management is looking for funds in order to have all the assets valued and will consider this in the budget for the financial year 2024-2025. Thank you, Chair.
Back to the auditors.
Thank you. We have seen there was an attempt to do the valuation of those assets that we requested, but they are yet to conclude the process the way they had indicated. It means that the value for those assets which we questioned are not included in the, we thought it would be included in the subsequent financial year 2023-24, but of course the way they have indicated, they will include it in the subsequent financial year. So I hope the matter still remains unresolved because the work is still in progress. They have not valued those assets.
What can you say about that? Because it's like you have just expressed your intention of doing good, and that is not. We are not sure of that. Could you please confirm your intention that you mean good with all that explanation?
Yeah, thank you. Oh, sorry.
Thank you, Chair. Indeed, our intention is good. We want to ensure that each and every asset in Jaramogi is valued. And I think this is when this is done, it will also sort out the issue that was raised by the auditor on the breakdown on the furniture. So if you look at all the attachment that we have attached, you will realize that there is an attempt by the new CEO to write a letter to the Chief Officer of Health. Chief Officer of Health has also done a letter to the County Secretary, and the County Secretary has done a letter to the valuers to come and do the valuation in Jaramogi. This will not only help Jaramogi because when you look at the letter that was written by the Chief Officer to CS, they are going to do the valuation in all the facilities. So that's something that we have been really struggling with. But finally, I think we are coming to an end of it. Secondly, you have also seen that we have attached a copy of the title deed. And this is a great attempt that this is a great thing that we have achieved in Jaramogi. Currently now we have a title deed. And we got this title deed in the last financial year when it was coming to an end. So basically, in the 2024-2025 financial statement, just as auditor has indicated, we will actually see a true reflections of the assets owned by Jaramogi. Thank you.
We understand, and we really know that at least you have tried. The other time we did not have the title deed. It was an issue over there. But now we realize you are doing something. But remember, what you are talking about today will come tomorrow, and we will confirm really. Before we go into anything, we will be asking you about these things. Because we will be recommending for implementation what to be implemented. And now when you will be coming for the year, audited year, the coming year, obviously we will ask you about this. So let it be your concern. We understand you have a good intention, but the matter is not resolved. Question, next question.
Unsupported trade and other payables. The statement of financial position and as disclosed in note 24 to the financial statements reflect trade and other payables balance of Kenya shillings 193,203,970. Trade payables of Kenya shillings 7,492,150 were not supported with payment vouchers, local purchase or service orders, delivery notes, invoices, certificate, interim or final certificates, and certified interim or final certificates and inspection and acceptance committee reports. In the circumstances, the accuracy and completeness of the trade and other payable balance of Kenya shillings 193,203,970 could not be confirmed.
Back to the accounting officers.
Thank you, Chair. Management has noted. However, it has provided the documents supporting the above trade and other payables for confirmation. The chairman and the members of the committee.
So you kindly put of your back to the auditors.
Oh, indeed, we expected supporting documents for the 7 million. That is according to our query. However, when we looked at the information provided, the delivery notes from KEMSA and from other organizations, we had some challenges because some of them were cut so that we could not even see the value. The information is not provided fully. We could not determine, therefore, that the information provided could support the 7 million that was queried by the auditors. Thank you.
Back to the management.
Thank you, Chair. It is true that the copies submitted did give a clear picture of the figures of 7 million. After discussion with the auditors yesterday, we agreed that I submit clear copies that can really support the 7.9 figure, 7.9 figure that I have with me here, Chair.
Hereby acknowledge a receipt of additional evidence concerning question 1.4. And I, this is all the copies. Are these the all copies?
Yes, Chair. The figure that you wanted us to clarify was on the 7 million that has
Okay.
been queried there.
Okay. Can you please check the details for clarifications? That is question 1. That is question 1.4. Submission of additional evidence. There was also another question we did with that. 1.3. Yes, yes. Yes. And being the generators of these documents, surely this is an audit query and is backed by law of the land. Why do you send a blank or something like fading? Why? Why do you have to do that? Because you are to counter check what you are providing to the auditors. Why do you need to do that?
Chair, we are very sorry for what happened, as being that the documents were in bulk, and by after printing, they are being binded. I think some of them just was an oversight on our side.
Yeah, oversight, but it's you. It's you. These are your documents. You are the generators of these documents. And when you are expected to provide, you must provide clean something which can be read and confirmed to be true.
We apologize for that, Chair.
And again, why do you need to provide these documents now? And you had all the management letter and all those things. Why? Because we know, why do we ask that? We expect that from Miranga Sub-County Hospital, but not Jaramogi. We expect you are efficient because we believe on what you are doing. We believe you can deliver. So why do we need to sort out these paper issues?
Yeah, thank you.
Unless, Buenasio, you have something to say.
Yeah, thank you, Chair. I agree that we had an opportunity to engage even with the auditors to ensure that some of these issues that could have been clarified earlier should have been done. And I want to confirm that these omissions, will not happen. I don't want to give any excuses, but I think, Chair, you are also fully aware of the staffing levels of Joorth when it comes to accounting department and accounting division. It's an historical challenge that we are trying now to correct. And therefore, what I can say is that we are going to put our house in order. At least to be one very, very critical unit, which we have never done, and I think has been raised before, having an internal audit department within Jaramogi. It is very unfortunate that this has not happened, and we are going to do everything possible. I've gotten confirmation from the county government that they are going to support Jaramogi, in providing us with an internal audit department that can assist us. Similarly, I think in terms of even finance capacity, we only have two qualified accountants. That's the director himself and the CFO. We are missing management accountant, we are missing revenue accountant, we are missing those positions. I don't want to use it as an excuse, but I want to confirm that we are going to put everything in order to ensure that this does not happen. In terms of minor omissions, which are also very critical, the issue of defaced copies, not clear copies, I think that's administrative, and I want to assure you that this will not happen. I think the issue is the documentation, the number of documents we handle, the number of audits we have. We have external auditors, we have got county auditors, we have got KRA. So sometimes I think in the haste of trying to meet deadlines, I think this omission has happened. But I want to reaffirm again that it is true. We are supposed to be the bearer and the lead Apex organization to, in fact, to become a model for the rest. And we intend to do that, God willing. And it's my commitment, Mr. Chair.
Thank you, CEO. I think everything is captured in the answered and for necessary action. Although some of them were not audit queries. 1.5.
Variance in revenue from rendering of services. The statement of financial performance reflects a balance of Kenya shillings 423,144,668 in respect of rendering of services, medical services income, as disclosed in Note 9A to the financial statements. Included in the amount is the National Insurance Fund reimbursements of Kenya shillings 155,042,127. However, the National Insurance Fund records revealed that an amount of Kenya shillings 152,889,673 was paid to the hospital, resulting to an unexplained variance of 2,152,454. In the circumstances, the accuracy and the completeness of revenue from rendering of services of Kenya shillings 423,144,668 will not be confirmed.
Back to the accounting officers.
Yeah, thank you, Chair. Management notes this observation. However, the management reported the figure as indicated and received in the bank statement totaling to Kenya shillings 155,042,127. Find copy of the bank statement attached for confirmation. That's on Annex 5. Thank you, Chair.
Back to the auditors.
they have not attached the document that could help us make a determination on and conclude on that issue. So that evidence is not properly provided to us from the documents provided.
Maybe to come clear, what evidence, what were you expecting, which was not provided? So management, if I give the members.
Thank you, Chair. When it comes to reconciliation of the NHIF, the monies that I received from the NHIF, I think we look at the bank statement, whatever was received, for which we provided, and they have the bank statements. And looking at what, because now we have to look at the NHIF, for us to reconcile, we have to look at the NHIF portal and whatever we received. During this financial year, 2022-2023, we were still using the old NHIF portal. And as per now, because this is our audit query, we are, during this finance period, we were not on Jaramogi. So what we were able to obtain is the bank statement for now. But now logging in back to the old portal was not possible for us because currently we are using the new portal, which is HIX. But we have acknowledged what the auditor has mentioned, and we'll endeavor ensure that we keep our records, and that is now currently what we are doing. We are doing daily reconciliations so that we don't end up with the variances that have been raised. But we had a challenge in terms of logging back to the old system, which is almost possible, or not possible, as far as FIF, not FIF, but NHIF system is concerned, sir.
Which financial year are we dealing with?
That's 2022-2023.
And when did we experience these changes in SAR and NHIF?
That is 2020.
And when did you,
2024.
from your financial statement, what did it reveal? Is it 2023, 2024, or 2022, 2023? But that time you had all the time to get into the system. Were you trying to cling on to issues which just came yesterday?
That's why, sir, I've mentioned that going forward we'll be reconciling our daily revenue.
No, but issue of NHIF being transferred to, how is it related to this? Because these are different financial statement here.
It is because even if it's a different financial year,
yeah,
in the NHF system you can always go back to those previous years.
Yeah, that is right. You made a financial statement. Each and every year you have to make a financial statement.
Yes.
And that is what you present to the auditors.
Yes.
See, that is what it is.
Yes.
So if they require anything, you just refer from your past documents. Then you present them. Because actually you had the access, the bank, and everything.
I think you have put it very correctly. That's incumbent upon us. It's actually our responsibility, to ensure that whether we are there or not, to ensure that this audit query is brought to conclusion. And therefore, I would just like to request your indulgence, and also for the auditors, that we have to do the reconciliations. We have to go back to the system, at least until this 2.152.454 figure is actually concluded, because it will never go away. So I think it is we request that just give us a time that whether we are there or not, I think we carry the responsibility of ensuring that these public funds are accounted for. So I beg for your indulgence, Honorable Chair.
Thank you. Honorable members.
Yeah, thank you, Chair. Chair, I believe this account for KCB is basically for NHIF in terms of what they remit to Jaramogi. And as such, every receipt, the totals should total to what they received from NHIF. And if you check at the cumulative total from the 1st of July 2022 up to 29th of June 2023, that is the year we are in now, in this audit query. The total receipts was 161 million point some 791, and in the statement we have 155 that they declared for the same. Hello. So I just want to know why the variance that big. So we have 161.7 million, which was received from NHIF as such, and the amount declared is 155, and that's what the auditors are referring to, which is also having a variance of 2.1 million, which they cannot be explained. The total unexplained should be more than that because we have 161,791,000, and of. I know this account you cannot spend from here. You spend from another account. But of interest is the transfer on 29th June. You know, Chair, on 29th June, we have to have a bank certificate for all the accounts. And the movement of 35 million on 29th June to this other account where we do expenditure on, it would be interesting to know where Jaramogi now spends the other account, which received this on 29th June at the closure of the financial year. You know, the assumption is before this financial year ended, they should have transferred the money to the other account and spend it as such for that financial year. But we were moving to another financial year on 1st July 2023, and the movement was done on 29th June. So I think if they can explain what really happened and why that sudden transfer on the last day, and for what purposes was it to be spent on in the other account. Thank you, Mr. Chairman.
Counting officers.
Thank you, Chair. Thank you, honorable members. The total money in, if you look at the balance as per 1st July 2022, there is balance brought forward of 11 million. And then this money, this account is not only receiving funds from NHIF, is our collection account. So if I talk about collection account, it means that there are also other insurances that might have transferred money into this bank account. It is not only NHIF, but the auditors were querying the transfers from NHIF. Secondly, the funds that were transferred.
Before you move,
yes,
you said some insurance did what?
This account is our collection account. So it means that if there are other deposits, those who want services in Jaramogi and they are not able to pay through M-Pesa or through cash by this particular time, this is the money that the Jaramogi has been using to collect the funds.
Back to, yes. Director, remember we have the statement from the bank also. You also attach that. That is your document.
Yes.
So could you answer that question?
If you look at there's on 15th of September, if you look at there is transfers that are coming in as inward SWIFT. And there are some that are coming in as salary payments. So salary payments, when NHF are paying it, normally they come as salary payments. We also have another insurance company called AON. When they do pay, the funds normally come in as inward SWIFT from director and nations. So on 29th, that you are asking the transfer on 29th to the operations account. To the operations account, the funds were transferred, but it doesn't mean they were utilized wholly on 29th. So if we are allowed, we can also, later we can produce the bank statement for the operations account to ensure the funds that the facility was able to utilize on that 29th of 2022, 29th of, that's 29th of 2023. And the balance brought forward now on 1st of July 2023.
That is a concern which is brought by what you flagged as an issue. So what is your response, Office of the Data?
Thank you, Chair. It is true what the management has said, alluded to, that this KCB account is a correction account. The correction account corrects all the revenue, and when the revenue is corrected, some of it is taken to the CRF if it is allowed, and some is spent within the hospital. So it is true. The only thing they can do is to do a reconciliation so that we solve the problem of the 2,154,455. Only that.
And so far, you have been meeting them, you had them in your management meeting, and I also understand you met yesterday. Is this a concern that you have been raising? Because each and every time we are talking about reconciliation, and it is an issue. And they have somebody representing the facility in the name of a chief accountant.
Thank you, Chair. I think we had a discussion with the accountant or hospital accountant concerning the same. We actually agreed, and she said there are difficulties in reconciling that is her statement, those figures because of certain difficulties that they are facing. But we still encourage her to find a way and conclude on the matter. But as far as our interaction, we do interact every year, as we do when during the time of the audit, and we interacted during this time of the audit, and we discussed, we audited their accounts, and the second one is now when we have a chance also to interact with them through your committee, so that we interrogate these matters. But what we must accept, we don't frequently interact on those issues until we are prompted the way you did. Thank you.
Thank you. We agreed that we are going to find, they are going to provide a reconciliation of their transactions very clear to support the other documents which were provided. Question
Variance,
1.6.
Chair, variance in trade and other payables. The statement of financial position reflects trade and other payable balance of Kenya shillings 193,203,970 as disclosed in note 24 to the financial statements. The balance includes Kenya shillings 40,269,846 owed to Kenya Medical Supplies Authority, while KEMSA records reflects Kenya shillings 41,300,612, resulting to an unexplained variance of Kenya shillings 1,030,766. In the circumstances, the accuracy and completeness of trade and other payable balance of Kenya shillings 193,203,970 could not be confirmed.
Back to the accounting office.
Thank you, Chair and members. Management notes this observation. The statement of financial position reflects trade and other payables balance of Kenya shillings 193,203,970 as disclosed in note 24 to the financial statements. The balance includes Kenya shillings 40,269,846 owed to Kenya Medical Supplies Authority, that's KEMSA, while KEMSA records reflect Kenya shillings 41,300,612, resulting to an explained variance of Kenya shillings 1,037,66. The variance of Kenya shillings 1,037,66 was due to the invoice dates that were after 30th June 2023. This amount is accounted for the financial year 2023-2024. Thank you, Chair.
The auditors.
Thank you, Chair. We discussed about that difference of 1 million, and the difficulties I had is with the documents which were provided, I could not confirm this 1 million, how it was addressed. Although they said it was money that was it was there in the subsequent audit, it was not captured in the financial year under review, but it was subsequently captured in the next financial year, which I think we requested for additional information to confirm the same. I don't know whether she managed to get any additional information on the same.
Back to the management. Maybe you can respond to that question.
Thank you. Yes, as the auditor has indicated, they requested for additional information which the accountant has now provided. So if you allow us, we can table the additional information to confirm this amount. Kindly.
Bwana Auditor, specifically what were you looking for? What did you expect that maybe if there's any additional document be given?
captured in the subsequent financial year. Only that.
Is that the document you are presenting?
Thank you, Chair. I have to inform the House that KEMSA being our main supplier, and the auditors wanted the difference of 1.1 million and some hundreds. I managed to get invoice for KEMSA totaling to 2 million. Being that we normally do continuous businesses with KEMSA, even as we stand, as we talk now, we are owing them money. So I carried an invoice just to explain that the variance in the amount that was raised was an amount that overlapped in the subsequent financial year, as I explained in the document. After our discussion yesterday, you requested me to carry just an invoice to confirm if there's an invoice that can really support that, and that I did. Thank you, Chair.
I think as an accountant, you know what we are looking for. We are not looking for a large amount or less than or more than. It was just to confirm about this amount of money. And if you are requesting anything, you should have requested something to support this amount of money. But the moment you bring a bulk transaction of that 2 million, which is not our concern really, that is not what it has concern, it's going to raise a lot of issues again. I don't know whether you understand that.
Thank you, Chair. I've got you clearly. And I request, with your permission, being that the time was short, that you requested for the document, to give me more time that I can really look for the one that was telling me the exact figure that he wanted us to put additional information.
Surely that was the issue which was raised. Or you are concerned about some 3 million or 4 million?
Chair, we wish to agree with the management that we give them some time so that they can give us the invoice. Actually, it is yesterday that we brought that to the attention of the management of our request. So kindly give us some more time.
So we concur that any invoice should indicate very clearly 1,030,766. Because that is the audit query. We should not get out of the audit query. That is very clear. Thank you. So we are giving you time to submit the necessary documents to the assembly within 1 week, and we will forward them to the relevant authority, which is the Auditor General's office. Thank you. Question 1.7.
The Chair, the issue of budgetary control and performance and the other matter, those issues are for information to the management. They are not really audit queries. So I request that I go to the query on stalled construction of cancer center. The management entered into a contract with a construction company for the construction of a cancer center at the hospital on 11th May 2020 at a contract price of 1,165,622,113, with the expected contract period of 18 months. As at 30 June 2023, certified works were valued at Kenya shillings 115,085,931, or 69% of the contract sum, and the contractor had been paid Kenya shillings 98,028,732. Physical inspection conducted in March 2024 revealed that the project had stalled. In the circumstances, the public did not obtain value for money in respect of the expenditure of 98,028,732 incurred on the construction of the cancer center.
Yeah, thank you, Chair. the contract was terminated under mutual agreement between the client and the contractor. The contractor has since issued the client with an acceptance letter. The client, therefore, does not anticipate any litigation. Based on the advice of the Auditor General going forward, the client has written a letter to the county attorney for further advice and direction. Going forward, the county government of Kisumu has entered into a contract with the Russian government on public-private partnership (PPP), and MOU has since been signed to ensure the completion of these projects toward benefiting the citizens with and outside the great county of Kisumu.
The client did not provide to us any clear progress made towards the effort which they have said they have put in place to resolve the matter. But the matter, what the actual progress made was not addressed because there was no any documentary apart from what they had said. We did not see any documentary evidence to support those assertions, which were not included in this bundle of evidence that were provided to us. Although the statements are there, they made a statement, but every statement must be also be backed by some evidence to help us confirm the correct state of affairs.
Thank you. Actually, we wanted the directness, but then we want the management to be very direct on their responses, because from what you're giving, it is not possible to establish how factual the statement that you're giving is correct. If there is any letter that can be provided to the community for review, then we'll appreciate that. If you have anything to say about the factualness of the statement, then you are free to give that.
I would like to make 2-3 observations here. One is that we are supposed to provide and will provide, the consent. I think that was entered, and the agreement that was entered between the client and the contractor for mutual engagement. Two, I will also be in a position to get the MOU, with the Russians. That's actually sitting with the county government, but I think I'll be in a position to get it, or be in a position to get that one. I think the others, I just wanted to bring the attention of this house that we are also not sitting really leaving this stall project to be stalled. We all appreciate that radiotherapy is very, very important for our people. In fact, in the whole of this western region, we don't have radiotherapy, support in any public hospital in Western Kenya. And what we are saying is that for our patients who go through chemo, they must also go through radiotherapy. As we speak now, we send them to MTRH or ANH. What we have done is that as management, I think the last 1 year or so, we have actually brought in the national government, to come and support us here. In fact, we have evidence. We brought the minister here for health, and we even made a commitment, in fact, that we wrote to them, and I'll bring you the letter, that we probably require some additional funds for them to finalize for us the bunker. Because if we can get the bunker ready, it's also very easy for us probably to get, someone to place that radiotherapy machine. So we'll also get you the letter that we wrote, to see to it that this toll project, comes to fruition. So, Honorable Chair, I think I want to request that probably give us time. I think even if it's a week, we can actually provide all that information to demonstrate that there is evidence. For now, we want to resolve this matter.
Members, if there's anybody with a concern on that. from if there is no any concern, then I think the recommendation will be each and every time an issue is raised, kindly try to come with the supportive documents. And by the from the issues that were raised, I always believe that there is a what the auditor wanted to be addressed, but from most of the responses that you've been giving, they are not quite direct to the concerns raised. And from the request that has been made by the CEO, we will give you a week to avail the document. So the issue is still not resolved. The auditor, to the next question.
Yeah, the next issue is stalled construction of neurosurgical ward. The management entered into a contract with the construction company for the construction of a neurosurgical ward on 15th May 2020 at a contract sum of Kenya shillings 18,226,440 with a contractual period of 6 months. Physical inspection of the ward conducted on 3rd March 2024 revealed that the project had stalled 39 months after the expected completion date. Management terminated the contract citing the contractor's lack of performance, dissatisfaction of work, and failure to complete the project within the stipulated timelines after the contractor having been paid a sum of Kenya shillings 16,106,746. In the circumstances, the value for money has not been realized in the expenditure of Kenya shillings 16,106,746.
To Chair, it is true that the contract was terminated in line with the signed agreement, highlighting the basis of termination of the contractual agreement. However, the management budgeted for the completion of the said project in the financial year 2023-2024, which was taken through procurement process. The project is now complete towards service delivery to the citizen within and outside the great county of Kisumu. Copy of LSO and completion certificate attached for confirmation. Annex 6.
Back to the auditors.
Oh, thank you, Chair. Of course, there was certificate of payment is provided. However, we still requested completion because they are saying it is completed. When it is completed, they always issued with the completion certificate. And if it is handed over, there is also a handing over certificate. So if they could share with us that, we could confirm that the project is completed and can be put to use. Thank you.
Has the building been handed over by the contractor formally? And if it has not been handed over, then when will the handing over take place?
Yeah, thank you, Chair. Yeah, I want to confirm that the building is completed, the ward is completed. We have not taken over, and I think the contractor has not handed it over to us officially. I want to commit that we are going to do this, in fact, very soon. We have no option. There is no reason why we cannot take it, and we don't have this certificate of completion.
When do we expect the certificate of completion?
Thank you, Chair. We also request for a week that this should be done.
Members, any issue on that? The auditors, since the certificate of completion has not been provided and they're promising to give it in a week's time, what's the status of the concern?
The status of the project is that it is not, or the matter is not resolved.
Okay, let's proceed to the next one.
Unutilized medical equipment. The statement of financial position reflects property, plant, and equipment balance of Kenya shillings 2,855,201,687 as disclosed in note 22A to the financial statements. This amount includes managed equipment services, MES, equipment outsourced by the Ministry of Health. However, physical verification in the month of July 2024 revealed that the contract between the maintenance service provider and the ministry had expired. Therefore, some equipment, including Leno dialysis equipment, intensive care unit, ICU equipment, theater equipment, X-ray and other imaging equipment, were not functioning and had not been serviced as at 30th June 2024. In the circumstances, the value for money in respect of managed equipment services, MES equipment, could not be confirmed.
The medal.
Thank you, Chair. It is true that the amounts includes managed equipment services, that's MES, equipment outsourced by the Ministry of Health, and contracts between maintenance service providers and the ministry had expired. This has made the operations of equipment not to be at 100%. However, management has been engaging some service providers to maintain them.
Yes, with the auditors.
Oh, our only concern is that they could not identify for us those other service providers that have been identified. We wish those could be supported in your evidence provided and the progress made in servicing some of this equipment, which I think some are very old and dilapidated. I don't know the correct position of this equipment now, whether they are in use as a result of that service or most of them cannot be serviced even at all. Because we all know that they are very old equipment. It was supplied some times back.
Yes, management.
Thank you, Chair. First of all, maybe to get the date of the verification. The date on the date of the verification, so that we have a clear record. Was it done on July 20?
Yes, that's the date.
July 2024.
Yes.
So we have provided the evidence from the service providers that we have engaged other service providers to service our machines. I think that's a discussion you had with our chief accountant yesterday, and we have carried the documents to actually confirm the same. Thank you.
I think I want to respond to performance of this equipment. Confirm that all these equipments are now fully operational. It is true that the government of Kenya actually terminated the service contracts of the MS. And it has actually put us in a very, very awkward position. And I believe not only us, but I think most other facilities. And therefore, I think as we table the service providers, we have also gone ahead to have some of our own staff, who are knowledgeable in this area to assist us. And we have actually managed to a great extent to have all these equipments, currently running. Thank you, Chair.
Are you able to the supporting evidences? I confirm the receipt of further supporting documents, and I'll forward them to the auditor for verification. Thank you. Yes, the next issue.
The next issue is on non-compliance with universal health coverage requirements. Verification of services offered, equipment used, and number of members of staff at the hospital revealed that the hospital operated with inadequate staff as detailed below. The level 5 requirement, available staff, and then the variance. So personnel, medical officers, level 5 hospital require 50 medical officers for it to qualify as a level 5 hospital. The available staff within the hospital were just 4, variance of 46. Anesthesiologist. The hospital requires 7, but we had 3 in place. The variance is 4. General surgeons, we had 4. The requirement is 4. We had 2 in place, and the variance is 2. Gynecologist, we had 4. 4 are required, 3 were in place, 1 was the deficit. Pediatrics, 4 were in place, 4 are required, 3 were in place, the variance is 1. Radiologist, we had 4, 4 are required, 3 were in place, 1 was the deficit. Kenya registered community health nurses, 250 are expected to be in place, 77 were in place, 173 was the variance. In the circumstances, the service delivery may have been affected due to failure to meet the requirement of the Kenya Quality Model for Healthy Policy Guidelines. Thank you.
Management.
Yeah, thank you, Honorable Chair. Management wishes to confirm that or affirm that we have signed an MOU with several training institutions like Maseno, Family Medicine, Uzima, Great Lake University, Jomo Kenyatta University, among others, towards bridging the human resource gap. Further to that, we have been accredited to offer COSESCA, ESCAP, CANASCA, and also EXACSCO training, leading to more registrars coming on board to bridge the human resource gap. Precisely, we have, for example, 50 registrars supporting and 16 medical officers. So, as you can see, the medical officers during the time of the audit were only 4 who were available. Now we are about 16 of them. Thank you, Chair.
Thank you, Chair. Explanation provided appears satisfactory, except that we are unable to confirm those statements because of lack of evidence. They have not provided any evidence to show that action or the effort they have made towards making good the gaps which they have confirmed from their from what we had queried. It's only we are lacking evidence to confirm that. Thank you.
Yes, the management.
Thank you, Chair. As the auditors raised the concern, it is true that we gave a response without giving the evidences. Although after our discussion with the audit team yesterday, they requested us to avail copies of the documents for showing that we've really increased the number of medical officers, which with us, we carried letters for engaging the additional medical officers. Thank you.
From your responses, I can see there 16 medical officers who are added there, but if you look at the available number, still it's 4. And we really appreciate the effort that you have. That right now, that we can be persuaded to take them as stories if there is no supportive evidences. We don't have the MOUs. So from where we are sitting right now, we'll still take them as an attempt, but the issue has not been fully resolved. The CEO, you have something to say?
Okay, thank you, Chair. We can also provide the MOUs between us and Maseno University. We can also provide the MOU between us and Uzima. We have provided here the letters of appointment of medical officers on lockup. Yeah, thank you, Chair.
Back to the members. Anybody with an issue on that? Next issue, auditor.
Chair, the next issue is lack of an ICT policy. During the year under review, the hospital did not have an ICT policy. This was contrary to Regulation 158 of the Public Finance Management County Government Regulations 2015 that provide that the county government entity shall develop risk management strategies which include fraud detection, fraud prevention mechanism, and a system of risk management and internal control that build robust business operations. In the circumstances, effectiveness of risk management measures could not be confirmed.
To the management.
Thank you, Chair, and members of this House. Joorth is operating under County Government of Kisumu, which has a functional ICT department and had adopted the ICT policy of the county as one of the entity within the county executive. Going forward, the facility will develop the ICT policy to ensure to ensure effectiveness of risk management measures. Chair, I think just to add a rider, yesterday, in fact not yesterday, I think the day before yesterday, the board has approved an ICT policy for Joorth, and I can confirm that you can within the next 1 week. But however, we have been relying on the county or the county of Kisumu ICT policy. Thank you, Chair.
The auditor.
Thank you, Chair. I think you stated that they are making progress, and we hope when we go there for the next audit, which is very near, we'll be able to confirm the efforts made towards having that policy in place. Thank you.
Maybe if I can give a question. It is true that the board approved the ICT policy with the hospital yesterday, but it's like we are relying on a hearsay, because if that was done yesterday, it means you would be having something to prove that it was done. We don't doubt that it was done, but I think it would have come up with that approval and the minutes and all those things to confirm that it is true you are moving in the right direction. Otherwise, we'll treat it as a hearsay. I wonder why the auditor is treating it as evidence to that effect, although he's not having anything to support that, Bwana CEO.
Thank you, Chair. I have even a soft copy of the same. In fact, I also have a circular that I've actually issued to all the staff of Joorth. It was not only on ICT policy, it was actually on 5 other policies. And I can actually give you a soft copy of the same now. Thank you, Chair. Hard copy, okay, thank you, Chair.
Molo. Molo.
Chair, I really want to applaud the facility for doing that. I think it is important. They were relying on the ICT policy for the county government. You see, we are not auditing the county government now. We are auditing the Joorth. And as such, you are an entity we should have its own ICT policy. You know, you have hospital management system, you have data, you have everything in that facility. So you ought to have done this, and it's good that you've really managed to approve the ICT policy. And I think our search chair said we will also have a look at it and see how it is going. And then this means that, chair, next audit, we shall not have this kind of query again, because as at then it will be that they have implemented the ICT policy and it's up and running. If there is anything needed from the assembly side, I think Chair will be ready to really assist and then oblige on that. Thank you, Chair.
Being the last, that is the last audit query. Maybe we have something. We also have issues concerning funding of Jaramogi. It is true that Jaramogi is doing good, and we need to support Jaramogi, especially on issue of budget, allocation of resources. We really believe if they can be given something, some money for development, they will do away with the debts which are hanging on their coats. You know, the burden debts in terms of budgeting and operations of the sector. So one of the issues which we must consider and probably take to the budget department, and Seto Kumu and Geoffrey Barindo are members of the budget committee. Believe if they can be given opportunity, they can do better. I don't know what you can say about that, because this is our baby. He's a big brother to the other sectors. Thank you. I'm giving Omolo first. Honorable Omolo.
Chair, I think that is in order, and I hope our colleagues in the budget will really adhere to that. But Chair, I just want to get from the management the transition from level 5 to 6. What did it come with, so that we are at par in terms of budgeting and knowing if this change of level from 5 to 6, which was gazetted, has any effect on budgetary in terms of what assistance they are getting from national government or otherwise? Thank you.
Before we give the Honorable Seth, Director, you can respond to that.
Elevation to level 6 is actually an assessment done by KMPDC to see or to assess the services that we are providing can be elevated or can actually be said to be of a level 6 national facility. And therefore, it is actually approval of the status that we can actually conduct or provide level 6 services. For example, in areas of specialties or even super specialties. The other
Honorable Seth and discussing you. Yes. CEO, you
Okay, thank you, Chair. As I've said, we have got two aspects when it comes to issue of elevation. One is we have been elevated by KMPDC to be level 6 facility, and therefore at the level of Kenyatta National Hospital, level of MTRH, level of Mathare, and I think a level of Kenyatta University Teaching and Referral Hospital, but only for purposes of providing services, where we are supposed to provide specialized services like also those facilities. But we are not a national state corporation. Those other referral facilities, all of them that I've mentioned, are being funded by national government. For us, I think what we achieved was it is the county government that has gazetted us as a county corporate, just as a corporate at the county level. I think it's the levels of Kewasco I think, on that level. And I think to actualize this, we are yet to come to the county assembly, to give us probably that legal mandate, in terms of an act. And this has happened to, I think, 3 hospitals, in the country now. I think Kisi, level 5 teaching and referral, the county assembly of Kisi actually gazetted it and made it, a county corporate. And for purposes of them even attracting funding. I think Meru has also done the same, and I think also Mombasa. So even for us, I think we are just on that trajectory, to become a county corporate, and then this should be indeed concluded by the county assembly with an act to make us operational. It has not attracted us any money. It has not attracted us any resources, but it will give us an opportunity to come as an hospital to seek for funding from the county assembly to meet some of these expectations of us. For example, being a level 6 hospital, we are supposed to have a cancer treatment center. Therefore, radiotherapy is very, very critical for us. And therefore, we need resources to make us actually conclude on the current stalled project. It also requires us probably to put in other new specialties. One of them is called, for example, cardiovascular. We don't have any cardiovascular issues of managing this county. We don't even have what we call a cath lab. I think we rely entirely on TENWEC and actually MTRH and KNH. So for level 6, we must have a cardiovascular or we must have a cath lab. I think for level 6 also, we are also supposed to start transplants, whereby we now probably start progressing towards kidney transplant, bone marrow transplant because of these specialties. We also expected, for example, also to get into plastic surgeries, to get pediatric surgeries. So we have quite a number of specialties that is expected of us being level 6 hospital. And all this requires funding, requires support. The only great thing that probably could happen is that if we get, the county assembly, to make us, a kind of an independent entity, it is possible using our documentations, our strategies to attract funding, locally, nationally, or even internationally. But at the end of the day, we are still a county saga or a county corporate that needs all the help, from the county assembly and from the Kisumu county government. Thank you, Chair. I think for last financial year, we allocated, I think, 90 million last year, but we only were given 60 million, I think, due to exigency of, I think, exchequer, and we are still awaiting for the 30 million. This financial year, we have zero. I think we have not been allocated any monies. It's expected that we rely on FIF, to manage our resources or to manage, all the exigency of duty at JOTRH, and that is not possible. In fact, we cannot manage. We cannot manage in terms of outstanding debts. We inherited about 300 million in terms of outstanding debts. We have inherited about 10 stalled projects. And I think with the expectations of our patients, they expect all our pharmacies to be full rate 100%. They expect our labs to do all the tests. They expect our imaging, to do all the contrast and all the whatever. So I think the point here is
what is your revenue collection? What is your total collection in terms of yearly collection? Your spanner people around.
So, thank you. We managed to collect a total of 432 million in the last financial year. So, and that is, 432 million as FIF.
Back to members.
Thank you. Thank you, Chair. Allow me to thank the Office of the Auditor General. I think you have a very supportive audit for this institution. And what we want out of this institution is a system. But even when they are not there, we are lucky to have people right now at JOTRH who are committed to have a change. but they might not be there forever. So we want you to help them have a system that will work even in their absence. So as you do your audit, we want to request that you help them develop systems in place. Honorable members, you've had submission by the CEO of JOTRH. Most members think that by the time JOTRH became a saga, then they don't need funding from the county government. That is very untrue. We really need to support them. I think they had a budget of 600 million. Like he's saying, they only collected 435. That leaves a deficit of 165 million that they need to get from other sources of funding that we get as a county. So for them to move to where they are, let's not believe that they don't need any more funding just because they became a saga. We really need to support them with funding so that they provide services to our people. And all members, you know, I know most of you have requested for waivers from this facility. These waivers means they provide services, but nobody has paid. In such situations, again, we need to give them money to cover for the waivers that they give to people who are really needy. So as we move on with budget, Honorable Chair, I think let's not forget JOTRH when we are appropriating for money so that they continue with the good services they are offering. I know the audit report didn't have so many questions. Most of them are answered, but we are praying that you get, is it, the best one is unqualified? Yes, unqualified. But I've lately been seeing unmodified, modified. I don't know the difference, but we want you to get the best audit report so that we are proud of the institution we are having in Kisumu County under your leadership, Dr. Lesiampe. Thank you so much, Chair. Those are my comments.
Let us give the budget, Chair. Thank you.
Thank you very much. I want to say I'm a friend of the committee, and it's just by coincidence I was passing by, and I was joking with Seth, why are we disturbing these people? We need to release them so that they go back. Mr. Chair, it's true that JOTRH, I still call it our baby, because in terms of FIF, they are really trying. And my comments will be very positive regarding JOTRH because of how they're trying when it comes to revenue collection. And when we made a decision not to allocate them anything from the exchequer, I mean, we are not making any transfers to JOTRH this financial year, though their budget is 650. And the main reason why we had a very long finance bill was primarily because of JOTRH. And we wanted to assist them to be able to collect the difference. I know you had, they collected 450, and we gave them a budget of 650. So meaning we expect them to improve by 200 million. And that is basically why we wanted to make some changes in our finance bill. We gave them a lot of leeway to, one, introduce some new fees and charges, and two, to improve on probably what they were charging low, so that they probably make it baseline with regards to what other hospitals are charging of their same level. And that is why I believe if it comes to on-source revenue improvement, I think JOTRH will be one of them. And probably at this level, I think the director can confirm. But I hear, I don't know, I've not seen the results, but I hear they are doing well. So let's hope they are averaging probably 70 to 100 million per month. Is it possible, CEO? That is what we were told. So I don't know whether it's the true picture from what the revenue board is saying, that they're averaging between 70 to probably 100 a month, because the target was 1 billion this financial year. So let's hope that they can surpass the 650. In terms of management efficiency, they have really tried. I've not been very keen on what we have in the audit report, but I believe it is one of the hospitals that have a lot of improvements. And if we continue supporting them, I think JOTRH can be our star, probably in terms of management and improvement on source revenue. So that is my input. And as a committee, just like my vice has said, we are always there to support. And I am one person who has always pushed so that if you inherited, though when I asked the director, they told me you had cleared your pending bill. I was very categorical about the pending bill that you inherited when you came in. I thought the hospital was struggling to pay, but I was told they cleared because we thought, okay, if we have 900 million budget for pending bill, how are we assisting JTRH to clear the bills? But I can see the director nodding there negatively. That is one area where I thought we could assist them, because if they inherited a very huge pending bill and now we are not helping them with any transfer, then probably we'll only push so that any transfer we only give them is primarily for clearing the pending bills that they inherited in the hospital. So CEO, with regards to that, we are open to having a conversation so that we see where the committee can help. Otherwise, I want to thank the chair, Pickback, for the good job and the committee. Thank you.
See, you have some response.
Yeah, nothing substantive, but Honorable Chair and Honorable Members, I just want to confirm that it is true. We only made 460 million last financial year, and we are trying to push to meet that by also the end of this financial year, we'll go to the 600 that it was set for us. I think in terms of performance, we have tried. I think in the last 6-7 months, we can say that on a monthly basis, I think probably I can even pick the last quarter. We used to be generating about 30 million in terms of performance. Performance means cash and probably any other insurances, including NHIF. So, but July, from I think I can say June, from June we have been making about 100 million plus, in terms of performance. So June, that's we made 100 million. I think July we also did 100 plus. August 100 plus. I think September 100 plus. So I think in terms of performance we are doing, but when it comes to realization of cash, it becomes a little bit of a challenge. For example, I think this quarter we have done 125 million, 134 million. But our performance, actually quarter, is this quarter we have done 350 million in terms of performance. But in terms of realization, we have done 125 million. So I think notwithstanding that, if we can realize, I think the performances in terms of NHIF or SHA, it means that we can actually do very well, that we can even hit a performance of 1 billion shillings annually. But on a rider, Kenyatta National Hospital, generates 8.5 billion. But they are given by the national government 12.5 billion. MTRH also generates, I think, substantial amount of money. I think almost 5 billion or so. But they also get almost another 6 billion from the national government. So what we are saying here also, and I think that's what the members have said, that notwithstanding the fact that we can actually generate substantial amount of resources, it's also important to realize that for development purposes, for purposes of providing efficient and effective services, we also need to get the support of the county government and also our county assembly specifically. And one major area is usually staff costs. The staff cost, for example, at UTRH is almost 1.7 billion annually. And therefore, I think I don't want to emphasize on that. But another very, very important aspect here is that if we can get, I think, reasonable, leeway, to charge something moderate. I'm not saying that we need to go beyond anyone. In fact, we don't even want to go to Kenyatta National Hospital cost or even MTRH, but something reasonable. I think that one can also help us, get the resources so that we can replenish, our pharmacy, we can replenish our labs, we can replenish our, management of our equipment. I think that's where the nexus of really us providing those efficient services. But I can confirm to this House, we are committed to make those changes. We are committed to transform this facility. We should be excited even as a county that we have now a national, level 6A hospital, though being managed by a county government. I think that is something that we should make us very, very proud. The only thing that we still need help, we still need some support. For example, I think in terms of outstanding debts, we had inherited 300 million. At the same time, we are trying to clear it. At the same time, we need medicines, we need reagents, we need everything for our patients. So sometimes it becomes very, very difficult to balance the two. So I think, as the Honorable Budget Chair said, please assist us to clear that and probably assist us to sort out some of these toll projects. Once we are finished with them, we can be in a position to say that we can break even, and probably we might not require as much subvention from the national county government, to push us to provide our services. Finally, stall projects, we have done everything possible. We have finished the Neuro Ward, it's okay now, running. Prime Care Center is also running, generating to us about 10 million shillings a month, through the insurances, which it has capacity of 30 million a month, the same way Kisi is doing. We have now finished also Victoria Hospital. Victoria Hospital, Milimani, we have actually finished the renovations. We think should be ready in either December, to start running as a sickle cell center, and also, a mother and child hospital. We are also finishing the kitchen, which was there. I think the kitchen was told, it's now finished. We have the ramp, which was told, we have now advertised to get someone to come and finish it for us. The lift, we have already brought it. The lift is now being prepared. I think we are going to have the lift done so that we can actually access those 2 floors. We have also procured beds, 150 beds. So we want to push this hospital to have at least 850 beds, from the 510, so that it can actually serve the whole of Kisumu and the Western region. So with your more support, with your encouragement and inspiration, we will definitely be somewhere by the end of next financial year that we can be proud to say that we have achieved great in clinical outcomes for this facility. Thank you very much.
Budget Chair?
Yes, Chair. I just wanted your intervention so that the CEO can give us the figure probably of the pending bills, if you can mention a figure. And then on the stall projects, can we also know the total cost of the stall projects, so that when we are thinking of an intervention, we are talking from a point of reference? And then lastly, he's mentioned that if we can help them probably improve on their costing so that they be somewhere that again can help them improve in terms of their collection. So I don't know whether the interventions we made during the finance bill are enough to take them up to another step, because I am aware we gave them a lot of leeway to make so many proposals, which we did accept. And everything that we passed in this assembly was probably most of the intervention. So can you also come clear on that so that we know whether we made step, how much is the pending bill, and then how much the total cost for the for the projects that are incomplete? Thank you, Chair.
Bwana CEO, you have heard the guidelines, what is expected from, so that actually will inform whether you are being supported or not. Because actually you have to prove that really you need that money, and what are some of the interventions which were proposed by the Assembly and everybody, giving you a leeway to charge on some of the other charges, services offered by the hospital. So these are some of the issues. I think you should make you should prepare for a meeting with the relevant Ops committee so that we sort out some of the issues. I think if we can only give you something like 100 million, probably in a financial year, you'll be in a position of reducing that debt of 300 so that we move forward. That will always work. But until then, you come up with a proper answer on these issues and you meet together. Otherwise, thank you very much, members of the County Assembly, the staff, the Office of the Auditor General, and the accounting officers from JTRS. We still believe we'll work together as we have been doing. Our main purpose here is focus on wananchi. It is not the executive, it is not the auditors, it is not the members of the County Assembly. The main issue, our focal point is the wananchi. So if we can provide the best for our wananchi, I think that is what we need so far. So thank you. We appreciate the strides you have made. We believe you can still do better than what we are doing now. So we wish you the best. Thank you. And the meeting remain adjourned. Thank you.